This is going to be a motion that I like to do, especially if you have someone who has collapse or a little bit of a concavity on one side of their trunk, especially your patients with scoliosis, but also some people just tend to be tighter on one side. Now, I use the wall, and I take my hand to the wall, and I start to let it climb up the wall. Right? Now, I got to be respectful of any shoulder pain. So if there's any pressure in the shoulder, I make sure I stay below that threshold. Anything down here is good, anything up here is not so good, right? Now, as my arm goes up the wall, it's going to make me want to lean like this, which I don't want. So I tend to bring this hand up on top of my head, or sometimes I'll have people hold like a high post here to make sure that they stay up tall. If anything, when I do this, I want to think about my weight kind of shifting a little bit towards the leg closest to the wall, right? Now, in this position, and hopefully I feel like I'm kind of opening this side, I like to think about breathing into my ribs over here. So as you see my hand right here, as I take a deep breath in, I want to feel my ribs kind of expand to open that side, right? So usually I'll do some deep breathing here. I have people trying to look at that they're letting their body kind of lean a little bit towards this hand on the wall. And I'm really just watching their hips, their pelvis, to make sure that their pelvis is not starting to do this. So like I said, if anything, as my weight is on this hand and my weight's a little bit more on my right leg, I almost feel like my leg that's away from the wall, that heel is kind of coming off the ground a little bit. It's almost like this leg has a little less weight on it, as I'm putting a little bit more weight on the leg closest to the wall.